Hi, learning maxillary artery can be a as simple skill as I can teach you, or as difficult skill as you try to learn it from the book. So basically, we understand things if you know, we know things if we actually understand them. So basically, trying to understand maxillary artery. Now, maxillary artery, for our convenience, it was been divided into three parts, and so that we remember all those branches under subcategory. This particular artery is basically the terminal branch of the external carotid artery, which is again a branch of carotid artery. So, this maxillary artery, as it divides along the some structures, like when it divides along the mandible, when it divides along the pterygoid, and when it divides along the pterygopalatine part, it is divided as per. It is divided into parts as per that. So first of all, when we talk about the division along the mandibular artery, once the mandibular artery is going to come along medially through the external carotid artery, once it is going to come medially, as it is medial to the sigmoid notch, it is going to have this mandibular branches. So first of all, the mandibular part, you can remember it as DAMIA. So D stands for deep auricular artery, A stands for anterior tympanic, M stands for middle meningeal, I stands for inferior alveolar, which is again divided into mylohyoid, and A again stands for anterior tympanic. So these are the five branches of the first part. Next, when it comes along the pterygoid bone, it is mainly going to give branches to the muscular structures, or maybe the muscles of mastication. But first of all, it is going to supply the posterior temporal it is going to have the branches posterior temporal artery. Then it is going to have the branches pterygoid, which is going to supply the pterygoid muscles. Then it is going to have the anterior temporal artery. It is going to have buccinator and masseter artery. So these are the branches of the middle part. And finally, the third part, that is pterygopalatine part, it is going to divide into, first of all, posterior superior alveolar artery, which is going to supply the buccal part of the alveolus on the posterior section on the teeth along that side, the infraorbital artery which comes from here, and it is going to supply all these teeth and all the alveolar bone here. The spinopalatine artery has greater palatine and lesser palatine artery, the pharyngeal artery to the pterygoid canal, and finally descending palatine artery. So overall, these are the three main parts of the maxillary artery and its branches. Thank you for watching. Please subscribe.